In this video, I will review 10 categories of medicines, many of them used to treat MS symptoms, all which can contribute to cog fog. Don't turn away, because that starts right now. Howdy, and thanks for learning about MS with me, Aaron Boster. Doctors are good at prescribing medicines. We do it readily. Here, try this. Here, I got a script for that. But we're not very good at removing medicines. What? And sometimes we prescribe a medication with the very best of intentions, and yet there are side effects which can negatively impact the person we're giving them to. A very common said side effect is cognitive impairment. And it turns out that many medications prescribed for good reasons can have a negative impact on thinking and memory. In this video, I'll be reviewing 10 different categories of medicines, all of them prescribed with good reason, which can contribute to cog fog. So get your pen and paper out and let's jump in. The first class of medicines to discuss are benzodiazepines, or benzos. They help with anxiety and with panic. They're prescribed very commonly, and they work very well. However, they can significantly contribute to difficulty with thinking and memory. Some believe they can contribute ultimately to dementia. They can contribute to increased fall risk, and they have a significant dependence. So you can kind of become hooked on them. And if you don't have them, you can go through a withdrawal. These are medicines that I personally try to avoid in my patients. I have a list here I'm going to read to you. I'll read you the generic name, and then I'll read you the American trade name. So benzodiazepines would include medicines like alprazolam, which is Xanax, Librium, clonazepam, which is Klonopin, is very commonly prescribed. Diazepam, which is Valium, is another very frequently prescribed one, as is lorazepam, which is Ativan, midazolam, which is Versed, temazepam, which is Restoril, and triazolam, which is Halcyon. All of these medicines can be prescribed with the very best of intentions, but they can significantly contribute to cog fog. And if you're on one of these medicines, it would be reasonable to talk to your doctor about if there's an alternative option. Hey! I also want to caution you that these are medicines that cannot be stopped cold turkey, or you can go through withdrawal. I recommend working with your doctor and using a very, very slow taper to ultimately get off these meds. The second category of medicines are antiepileptic drugs, or seizure drugs. These are prescribed by neurologists very commonly, not just to treat seizures, but oftentimes to treat neuropathic pain. I use them quite a bit for this purpose. Also, some of them are excellent mood stabilizers. Now, if you're on an antiepileptic, it may be for a very, very good reason, but it's important to know that they could contribute to difficulties with thinking and memory. I'm going to, again, read a list of commonly used anti-seizure medicines. These include carbamazepine, Tegretol, which could be used for a myriad of neuropathic pain symptoms. Gabapentin, or Neurontin, is a go-to drug for many neurologists to treat neuropathic pain. Lamotrigine, Lamictal, can be used for seizures or for mood stabilization or to treat neuropathic pain. Levetiracetam, Keppra. Carbazepine is Trileptal. Pregabalin is Lyrica, a very common medicine used to treat pain. Topiramate, Topamax, is sometimes jokingly referred to as Dopamax because one of the side effects is word-finding difficulties and thinking and memory issues. Valproic acid, Depakote, is an oldie. It's one which is used to break seizures. It's also used for mood stabilization, and so you could be on it for a couple different reasons. And lastly, zonisamide, or Zonogram. These anti-seizure medicines can serve a very important purpose, but may be contributing to cog fog. It's reasonable to have a discussion with your doctor about streamlining it if at all possible. Real quick before we go on, I have a favor to ask of you. If you like this video, do me a favor and give it a thumbs up. Also, if you haven't yet, please consider subscribing to the channel. Those two actions help the YouTube algorithm understand that you dig what I'm doing, and it helps push it out so that more people can enjoy and learn. Thank you. The next category of medicine are tricyclic antidepressants, or TCAs. TCAs are not used for depression much anymore. I don't see psychiatrists using them. I certainly don't use them in my practice for depression, but they are used for a bunch of other purposes, most notably for neuropathic pain. Neurologists like myself may reach for them when treating migraines, for example, or a host of other neuropathic pain conditions. The medication is sedating, so giving it to someone before bed seems lovely because it helps them get a good night's sleep. The problem is that TCAs can contribute to cog fog or worsen thinking and memory, particularly in an older population of patients. Now here's a list just to familiarize yourself with some of the more common TCAs. So this includes amitriptyline or Elavil and nortriptyline Pamelor. The fourth category of medicine, notorious for contributing to cog fog or difficulty with thinking and memory, are narcotic pain medications. Narcotics are a challenging medicine because there's a dependence and a tolerance that can develop. And, quite honestly, they don't work very well to treat neuropathic pain. I personally avoid prescribing narcotics in my practice because they don't work to treat most of the pain that folks with MS experience. So here's a list to familiarize yourself. Fentanyl, the trade name Duragesic, hydrocodone, trade name Norco or Vicodin, hydromorphone, which is Dilaudid, morphine, oxycodone, trade names OxyContin and Percocet. And there's many, many more. When I see patients with narcotics in clinic, it's my goal to try to get them off those medicines whenever possible. Number 5 are medicines to treat restless leg syndrome. Now, these restless leg syndrome medicines also treat Parkinson's disease, and they're considered dopamine agonists. The problem is they can contribute to difficulty with thinking and memory. These include pramipexole or Mirapex and ropinirole, which is Requip. Number 6 are beta blockers. Beta blockers are medicines to help with high blood pressure, sometimes to control a fast heart rate, to help with certain types of headaches. Beta blockers, however, can contribute to difficulties with thinking and memory, and so I want you to be aware of them. Most of the beta blockers end with alol, so you may recognize them as such. Things like atenolol, carvedilol, metoprolol, and propranolol. Insomnia is all too common in the setting of MS. And the next category of medicine, which unfortunately can contribute to cog fog, are non-benzodiazepine sleep aids. These are very commonly prescribed medicines, things like Sonata, Lunesta, and Ambien. And if you're on them, we have to keep in mind that they may be contributing to difficulties with thinking and memory. It's oftentimes my goal to get people off long-term use of these medicines in favor of sleep hygiene techniques or even over-the-counter melatonin, which I find does not contribute to difficulties with thinking and memory. Number 8 is arguably one of the most concerning categories, and drugs that I oftentimes prescribe in MS patients. These are anticholinergic overactive bladder medications. So many people impacted by MS have to go right now. They have bladder urgency, they have frequency, they have accidents because they can't get there in time, they have nocturia, waking up, and so we prescribe them a bladder medicine, which is awesome, but we have to keep in mind that it can contribute to difficulties with thinking and memory. These can include medicines such as Enablex, Ditropan, Detrol, Vesicare, and Sanctura. Of note, Myrbetriq is not an anticholinergic and does not contribute to cog fog. Number 9 are first-generation antihistamines. These are very commonly used medicines like Benadryl and Atarax or Vistaril, which can be used for anxiety. It can be used to help as a medicine to tolerate other medicines, or it could be used for itching, and unfortunately can contribute to difficulties with cognition. I call out Benadryl in specific because it's available over the counter and many people use it as a sleep aid. It could contribute with difficulties in thinking. The 10th category of medicine are antipsychotics. Excellent medicines, but with a side effect profile that could contribute to difficulties with thinking and memory. These include medicines such as Haldol, Risperdal, Zyprexa, Seroquel, and Abilify. So, what do you do if you're on one or more of the medicines that I listed in this video? Well, first of all, don't freak out. It doesn't mean that your doctor's terrible and done a bad thing and that you're doomed and that medicine is guaranteed to be contributing. I do think, however, it's worthwhile having a conversation with the doctor that prescribed that medicine. You may find an alternative option, or you may be able to reduce the dose of the medicine. And I always think it's a good idea to be talking about reducing number of pills and streamlining your meds. If you'd like to learn more contributors to Cog Fog, click the video that's on your screen right now. My name's Boster, and as always, thank you for learning about MS with me. Until my next video or my next live stream, or even better yet, the next time I see you at the Boster Center for MS, be safe and take care.